The purpose of this video is to train family and friends to help their loved ones to move while in the hospital. Being active increases independence and helps patients to go home sooner. All patients are evaluated by our staff to determine the best ways for them to move around. If your loved one is safe to move with your help, our staff can teach you what to do and what equipment to use. This video covers sitting up on the edge of the bed, standing up, moving to a chair, walking in the room or halls, and going to the bathroom. Note: if your loved one has bed or chair alarms, please call the nurse to deactivate them before helping the patient to move. Non-slip footwear is required. Take care that tubes and lines are not tangled or pulled. If at any time the patient becomes dizzy, nauseous, or lightheaded, stop what you are doing and call your nurse. Sitting up at the edge of the bed. Using the controls at the foot of the bed or on the side rail, lower the knees of the bed so that the patient has a flat surface to sit on. Help them to get to the edge of the bed. When your loved one wishes to lay back down, flatten the bed. Reposition or lower the side rail so that it is not in the way. The goal is that when they lay down, their head is less than 6 inches away from the headboard. Put the side rail back up so they can use it. The handles of the headboard can be a great way for them to scoot themselves up in bed as well. If your family member or friend wants to sit up in bed, please put the knees of the bed up first before you put the head of the bed up. Otherwise, they will slide down in bed. This can lead to low back pain, difficulty falling asleep, or other problems. Standing up. Gait belts are available in all patient rooms. Anytime a patient stands or walks, they should wear one to give caregivers something to steady them with. This can prevent falls. Place the gait belt around your loved one's waist when they are sitting. Be sure that the tag is on the outside. Insert the flat end into the claw of the buckle from the back. Next, double the belt over the front to insert the end through the other buckle slit. If the belt has a long tail, tuck it in to keep it from flapping around. If there is a reason it cannot be worn around the waist, it can be applied under the arms across the chest. Using a walker can significantly reduce the risk of falling. There should already be a walker in the room. The height of the handles should be at the widest part of the patient's hips. If the walker seems too high or too low, please contact your nurse to adjust the height. If your family member or friend is weak, they may have difficulty standing from a low surface. You can help lift from the gait belt at the patient's low back or by placing your arm under theirs. Moving to a chair. Make sure that there is a clear path for the patient to get to the chair. When the patient stands, they should pivot, using the walker for support. Throughout the transfer, keep your hand on the gait belt at the patient's low back. Cue your loved one to make sure that their hips and walker are fully lined up with the chair and that the backs of their legs are touching the chair. Have them reach back before they sit. Walking in the room or halls. If your family member or friend is walking well in the room and wants to walk in the halls too, try walking a short distance first before going farther. This helps to make sure that the patient does not experience any knee buckling, dizziness, or lightheadedness. Walk next to them, keeping your hand on the gait belt at their low back. Avoid tugging or pulling on the belt, as this can throw off their balance. Encourage them to keep their hands on the walker for support. Going to the bathroom. When you walk your loved one to the bathroom, make sure that the walker is lined up with the toilet and that they can feel it behind their legs prior to sitting. Encourage them to use the grab bar for support. Keep a hand on the gait belt as they sit or stand from the toilet. Do not leave your loved one alone in the bathroom. Although we respect the need for privacy, if someone is confused, dizzy, or has balance trouble, they could fall as they stand from the toilet. When you leave. If you are leaving the room for any reason, it is very important that you put the call light on and wait for the nurse. Let them know that you are leaving so that they will take over helping your loved one. The nurse will turn the appropriate alarms back on. These let our staff know if your family member or friend is trying to get up and move on their own so we can keep them safe. If you have any questions, please ask your nurse.